Welcome to All Around Health Talk and Happy New Year. If you're new to my channel, this is welcoming you to my channel and wishing you a very prosperous 2023. If you've been here on this journey with me, thank you so much for being consistent and I hope you're having an amazing 2023 so far. Now, if you're new here, I should tell you that this is a platform where we focus on living our best lives in terms of health. So I'm hoping that you're committed to living your healthiest life in this year, 2023. Now, to kick off the new year, we're going to be talking about a topic that I feel personally is not really talked about, right? And most times is a condition that is confused for something else. So I feel there is a need for us to talk about this topic on this channel. So we're going to be giving a voice to this medical condition. Now, did you know that there are women who actually feel sadness at the sight of their new babies? Do you know that there are women who feel hatred towards their new baby? Do you know that this whole child delivery thing, which is a thing of joy, actually causes pain and sadness to another woman? Well, today we're going to be talking about baby blues. Now, baby blues is a medical condition that is not really talked about, mostly because women are ashamed to talk about it. Why? Because we live in a society where a woman is supposed to experience joy, happiness, and a sense of perfection after child delivery. Unfortunately, this is not the case for all women. So I can tell you that 70 to 80% of new moms experience sadness after childbirth. Now, what is baby blues? Baby blues is the feeling of sadness that a woman experiences after childbirth. Now, baby blues is not postpartum depression, but it can be considered a mild form of postpartum depression. Now, when does it really usually occur? Baby blues tend to appear 4 to 5 days after childbirth, right? And the woman will have symptoms for minutes to hours each day. Now, the good thing is that baby blues only lasts for 2 weeks, right? So that's one of the reasons it's actually not postpartum depression. Now, I'm sure you want to know why baby blues happen. Well, scientifically, studies have shown that there is no known cause, but there has been relation between hormonal changes after childbirth, the expectations, the stress on a new mom in terms of the symptoms of baby blues. So we can say that these hormonal changes and this new routine and these new expectations could be a cause of baby blues. Now, what would baby blues look like? Baby blues will be a woman, a new mom who is crying randomly for no reason. She's irritable, she's tired, she's weak, she cannot concentrate, she cannot sleep, even when her baby is asleep, right? This is a woman who is anxious, she's impatient, she's having mood changes, she is sad, and she feels like everything is falling apart. She feels like she's failing at being a mom. These are symptoms that you would see in a woman who is experiencing baby blues. Now, what can be done? Like I mentioned earlier, baby blues last for 2 weeks. The good thing is that it disappears spontaneously, so there is no need for treatment. There is no actual medical treatment for baby blues, but there are things that we can do to help a woman who is experiencing baby blues. One of that will be a support system. So if you're a woman out there who is experiencing baby blues, make sure you have a good support system. It could be your family members of your husband, your friends, people you can confide in. And most importantly, try to speak about what you feel. Don't try to bottle it up. And I personally would recommend that you journal, keep a diary, and write about how you feel. That will help you express yourself so you don't bottle up so much inside. Then make sure that you're taking walks, eating healthy. Make sure you're doing other things that interest you. Don't just focus on taking care of your baby because that could be overwhelming. So make sure you have time to diet, to exercise, to listen to music, to do other interesting things. When you notice that something is off, seek medical help. Now, there's something that is very important, and that is knowing that baby blues is not the same as postpartum depression. Postpartum depression will last more than 2 weeks. Baby blues will last just 2 weeks. Now, baby blues will disappear spontaneously, but in terms of postpartum depression, you would need medical treatment. In the case of baby blues, your symptoms are mild and they don't affect your ability to function or take care of your baby. But in the case of postpartum depression, you will find yourself having symptoms that are so intense that you cannot function and you cannot take care of your baby. So these are ways to differentiate between baby blues and postpartum depression. Now, if you're a woman who has recently been experiencing sadness or a feeling of hatred towards your baby, you're probably experiencing baby blues. Try to get medical help. If you're a woman who has never experienced this, it's also important for you to have this knowledge because it could actually occur with any childbirth. So you probably didn't have it with your first or second child, but it could appear with your fourth or third child. In conclusion, women, you're not perfect. You're human. You can feel happy, you can feel sad. Don't put so much pressure on yourself to because you're a new mom. It's normal for you to feel down. It's normal for you to feel tired, sad because this is a new phase of your life. You're experiencing routine changes. You're not sleeping as you used to. Your moods are frequently changing, so it's very normal. So don't be too hard on yourself. That's what I have to say to you today. I hope that this video has been very educative, and I hope that you're willing to share it with other people so that people can know about baby blues. Also, don't forget to subscribe to my channel and make sure you leave a comment or a question because you know I always answer your questions. I'll see you in the next one. Bye.